Hi there, and welcome to Medford Care. Today we'll talk about shoulder pain, its reasons, and its treatment. Peter loved tennis. Now he hangs the racket on a nail. Antonio worked for 30 years as a farmer. Now he must delegate many jobs. James was a social health worker. Now he carries out small tasks. Maria was a very active grandmother. Now she can't play with her grandchildren anymore. Rose likes sparkling water. Now she drinks from the tap. And Rosella was a cook. Now she buys fresh pasta at the supermarket. For many people, these sentences may seem meaningless, but 1 in 4 adults will probably have a similar story to tell. In fact, painful shoulder syndrome affects 10 to 26% of the adult population. The shoulder plays a very important part in our daily lives, as it allows the upper limb and the hand to move in space quickly. So you may ask, why does my shoulder hurt? In the past, all the painful shoulder symptoms were incorporated in a single diagnosis, and in a generic and non-specific manner, it was called periarthritis. Currently, medicine is much more precise in determining the cause of this condition. The most frequent and identified are acromial conflict syndrome, rupture of the rotator cuff tendon, and scapulohumeral osteoarthritis. I know, the terminology is difficult, but we can talk about it in a simple and thorough way during the visit. So, how painful is it? The most important symptom is certainly the pain associated with the lack of strength in the arm and hand. Pain is an unpleasant sensory experience and is subjective. It varies from person to person. In most cases, however, the pain is chronic and can last for months. The pain can radiate from the base of the neck down to the elbow. It can accentuate during the common daily activities that involve the arm, like simple operations like dressing up, combing your hair, or taking a bath, and become very difficult for people suffering from painful shoulder syndrome. Pain can also occur at night while you're resting. It can hinder you from sleeping well. And if this pain is not adequately controlled, it can have a negative impact on a person's life, like it can jeopardize actually your interpersonal relationships. So, what should we do in case we experience shoulder pain? Home remedies and the improper use of drugs with pain-relieving or anti-inflammatory effect should actually be avoided. The family doctor should prescribe diagnostic and instrumental examinations such as an X-ray or an MRI of the shoulder. And after an objective examination, that's when the family doctor should refer the patient to an orthopedic doctor specializing on shoulder treatment. So, what will the orthopedist do with the shoulder? Well, the orthopedist will recommend the most appropriate treatment based on the extent of the problem. In general, the first approach is conservative. It consists of taking anti-inflammatory medicine and/or joint infiltrations of cortisone and hyaluronic acid combined with a physiotherapy rehabilitation process. This will help you fully recover your shoulder mobility and reduce pain. If this conservative treatment fails, then the patient must be elevated to surgical treatment. And now the question is the surgery going to be very invasive? Because everybody's scared about this. Currently, the most effective and modern surgical treatment is arthroscopy, an operation with reduced invasiveness that makes use of cameras. With the recent technological advances, it is possible to make small cuts to perform an acromion-plasty. This means that we fill the acromion, repair and reconstruct the tendons of the rotator cuff with small titanium and balloon screws. All of this is done in a precise and anatomical manner. And when the arthrosis condition is already advanced, Minimally invasive surgery no longer finds space, and that's when prosthetic replacement is necessary. This consists of placing an artificial implant on the shoulder in order to restore the correct joint function. That concludes our topic for today, and we hope you like this video, so we'll see you in the next one.